In this lecture, we will discuss the vascular supply of the conduction system. Myocardial ischemia and infarction can lead to a number of conduction defects. In order to fully understand these various complications, it's important to be aware of the vascular supply of the conduction system. Doing so will allow us to look out for these potential signs of ischemia. We'll start with the sinus node and work our way through the conduction system. So the sinus node is supplied by the right coronary artery in about 60% of individuals, and the left circumflex coronary artery in about the other 40% of individuals. Okay, so again, here's our sinus node here, and we're saying about 60% is the RCA, the right coronary artery, and 40% is the left circumflex artery. Okay, and you can follow our path here. Remember, here's our right coronary artery. You can see it going to the sinus node somewhere in this region here. And some patients you can have the left circumflex, which is the one coming off the left main coronary artery, also supplying it. Okay, now the AV node is supplied by the right coronary artery in about 85 to 90% of individuals, while the other 10% or so of individuals have the AV node supplied by the left circumflex artery. It depends on if the patient is right or left dominant, has a right or left dominant system. So our AV node, okay, mostly supplied by our right coronary artery. Okay, again, our right coronary artery. All right, our AV node somewhere in this region. Here it is in our display. Okay, so mostly we'll have it supplied by the right coronary artery, but sometimes it may come around in those left dominant people and supply it by that route there. Okay, so again, we'll put about 85% right coronary artery, 85 to 90, and then we have about 10% due to the left circumflex if they have that left dominant system. Now his bundle mainly is supplied by the right coronary artery, but may also get contribution from the septal branches of the left anterior descending artery, or LAD. Okay, so our his bundle, which is this portion here after our AV node, okay, and we're saying that the his bundle supplied mostly by the right coronary artery, our RCA here, okay, also supplying that his bundle. And you may have some of the septal branches off our LAD. So here's our LAD. Here are some of the septal branches that may come in and also supply the his bundle. Okay. Next we have the right and left bundle branches. The right bundle branch is supplied by the septal branches of the LAD and often receives collateral circulation from the right coronary artery or left circumflex coronary artery, depending on which is dominant. Remember, the more common right dominant system is when the posterior descending artery, or PDA, is supplied by the right coronary artery, while we said that the left dominant system is when the PDA is supplied by the left circumflex coronary artery. Okay, so now we're on that right bundle branch, okay, and we're saying that it's supplied by the branches of the septal branches of the LAD, which again are these ones here, similar to as we saw with his bundle. And then we said it could either be the right coronary artery or the left circumflex that also contributes it, depending on which side is dominant. Remember, so what we're showing here is a right dominant system in which the right coronary artery comes around and supplies and gives rise to the PDA that supplies the back of the heart. Then if we have a left dominant system, we said it comes from this left circumflex, comes around and gives rise to this. Okay, so those are two scenarios there. Remember, the right dominant is more common, so it's more likely that it will get its contribution from the right coronary artery. Additionally, the first third of the right bundle branch runs in the endocardium. It may receive oxygen from the blood within the ventricular cavity. All that blood within that cavity can actually supply part of this initial part of the right bundle branch. The next 1/3 of the right bundle branch then travels deeper into the myocardium, and that final third of the right bundle branch then travels back closer to the endocardium. Okay, so you can also have the ventricular cavity, the endocardium supplying some of that right bundle branch. Now to the left bundle branch, which is supplied by the LAD and may receive collateral circulation from the right coronary artery and the left circumflex artery. Okay, so here's our left bundle branch, which is this one here. Again, this would be our right coming to the right ventricle. Here's our left bundle branch. We're getting its supply from the LAD. Okay, so let me just erase this. So, okay, so here's our LAD, and it's supplying our left bundle branch, okay, over that anterior portion where the LAD runs. We also said it can get some supply from the right coronary artery or the left circumflex, okay. Again, our right coronary artery may supply it, and here's our left circumflex. Okay, so while we are here, it is the Purkinje fibers of the left bundle branch that innervate the interventricular septum, and not those of the right bundle branch. The right bundle branch does not start to give off its Purkinje fibers until the anterior papillary muscle's origin. All right, so off the left bundle branch, we have the left anterior fascicle and the left posterior fascicle. If you recall, the left anterior fascicle activates the anterior wall and is very susceptible to ischemia. It is supplied by the LAD. Okay, so here's our left anterior fascicle coming off our left bundle branch, okay, and we're saying that it's supplied by our LAD, okay, so over the anterior portion, which is somewhere in this region here, it will be supplied by the LAD, okay, so left anterior fascicle, mainly LAD supplied. The left posterior fascicle activates the inferior and posterior walls. The proximal portion of this fascicle is supplied by the right coronary artery and sometimes the septal branches of the LAD, where its distal portion is supplied by the anterior and posterior septal branches of the LAD, okay? So again, here's our left posterior fascicle, okay, in this case here, coming off, again, our left bundle branch, the proximal portion supplied by the right coronary artery, okay, here, as it runs more posteriorly around, okay, and it can also be supplied by some of the septals of the LAD, are these ones here, and then the distal portion of it is supplied by the anterior and posterior branches of the LAD, those septal branches, okay? So these anterior and posterior branches will supply that distal portion of the left posterior fascicle. All right, let's review what we discussed before we end here. Okay, so we looked at the conduction system, its vascular supply, okay, because we said this can lead to conduction defects. So we started with the sinus node, where we said it's often supplied by the right coronary artery, but in about 40% of individuals, the left circumflex artery can also supply it. In terms of the AV node, this is often supplied by the right coronary artery, right, because of its more dominant right dominant system. However, in those that have a left dominant system, the left circumflex artery can supply the AV node. In terms of the His bundle, often supplied by the right coronary artery, you can have some septals of the LAD that also feed it too. Now the right bundle branch has the septal branches of the LAD that supply it. You can also have the right coronary artery or left circumflex artery, depending on which is dominant, supply it. And we also said that that right bundle branch, the initial portion, and some of it is in the endocardium, so it may actually get some of the ventricular cavity supplying that as well. The left bundle branch gets the LAD that supplies it, as well as the right coronary artery or a left circumflex artery at times. The left anterior fascicle, mainly the septal branch or the LAD that's supplying it, and then with the left posterior fascicle, we have the proximal and distal portions, the proximal being supplied by the RCA and some of the septal branches of the LAD, and then with the left posterior fascicle, we have the anterior and posterior septal branches of the LAD that supply it. Well, that's the end of this lecture. We discussed the vascular supply of the conduction system. I hope you learned something.